Good morning, everyone. Thanks for joining Indiana SHIP, the State Health Insurance Assistance Program, for our Facebook Live Medicare Monday. I'm Susan here in Indianapolis, and I am joined by my lovely co-hostess, Megan Rogers. She's up in Plymouth, Indiana. And Megan is going to share with us about something that's really important to a lot of people. If you have an Advantage plan going into the new year, there's a special time for you to maybe make a different choice. And Megan is going to tell us how to do that, what the choices are, and all about what we call Medicare Advantage open enrollment period. So I'm going to be watching the chat. Feel free to put your questions in if you're watching us live. If you're watching us on our YouTube or later on Facebook, then if you still put your questions in, Megan and I monitor those and we will respond to your questions. So, Megan, good morning and thank you for preparing this presentation for us.
Good morning, Susan. Thank you. My pleasure. So let me get the slides up here and we will discuss what, why, and when of the Medicare Advantage Plan open enrollment. So we just finished our big enrollment period, the fall open enrollment, and we are going into another important open enrollment for people with Advantage plans. So this runs from January 1st to March 31st of every year. And if you have an Advantage plan starting January 1st, you can partake in this open enrollment. So what can you do? So you can switch your plan. So you can move from one Advantage plan to another. You can also drop your Advantage plan completely. You can go back to what we call original Medicare with your Part A and your Part B, and you can enroll in a Part D plan for your prescriptions. That's very important to have. You don't have a standalone Part D plan when you're in an Advantage plan because generally the Advantage plan comes with the Part D coverage bundled in it, along with your A and your B. Now, what about supplements, your Medigap, your secondary insurance? If you go back to original Medicare, you drop that Advantage plan, you get a Part D plan for your medications, you still need some kind of secondary insurance. That can be TRICARE, it could be VA benefits, it could be Medicaid, it could also be a Medigap. And that is your supplemental for your Medicare. You do have to pay an extra premium for it. And if you've been on Medicare longer than 6 months, then you could still try to get a supplement, but they're going to look at your health history. So if you do have health issues, you may run into some issues getting that supplement. Or if you don't really have health issues, you shouldn't have a problem going through the medical underwriting. But those are the kinds of things that you can talk to your SHIP counselor about. I just wanted to touch on it briefly because that is a question that we get a lot with the Advantage Plan open enrollment. So just know that you would have to think about secondary coverage and your health may play into that. So what else do you need to know? You can only make one change during this time. The new plan will start the first of the following month. So if you make this change in January, it'll start February 1st. If you wait until March to make this change, it will start April 1st. And then if you do not start the year in an Advantage plan, you cannot do anything during this Advantage Plan open enrollment. If you're on original Medicare, if you have a supplement, if you have a Part D plan, you might be able to use other enrollment periods to make changes, but you would not be able to use the Advantage Plan open enrollment. So a common question that I at least get is, do I really have to do anything? Am I required to do anything during the Advantage Plan open enrollment? And the simple answer is no. You're not required to do anything. You're not required to make a change during the Advantage Plan open enrollment. You're not required to call your current Advantage Plan to say, hey, I'm staying in it. You're not required to do anything even during the fall open enrollment. I don't know about you, Susan, but I had a couple people come in during fall open enrollment, and I was like, okay, are we just reviewing your plan for next year to see if there's anything better, or anything about your current plan that's changing that you don't like? And their answer was, I'm here to re-enroll in my current plan. Did you get any of that, Susan?
I think sometimes it's confusing
Mm.
because the plans sometimes for people are so new at the first of the year, they think they have to re-verify or something
Mhm.
like that. So
Mhm.
I think that probably is a common concern, Megan.
Yes, thank you, Susan. So why would you still want to review your plan? Or do you? It's beneficial. It's not required, but it's very beneficial, and it is something that we recommend, because things change. Your health might change, your doctors might change, your medication needs might change, and then your plan might change. The coverage that that plan has, the prescription drug coverage, the formularies, extra benefits that Advantage plans have might change. They might add on or they might drop. The cost. So every year we generally see premiums change, deductibles change, your max out of pocket change. Generally, it goes up. I know we had maybe one or two drug plans that had some things decrease for 2026, but generally our prices are going to go up. So you want to make sure that your current coverage is still good for you. And something that I talk to my beneficiaries about every fall open enrollment is the Advantage Plan open enrollment, because it can become a safety net for you. So if you're going from original Medicare to an Advantage Plan for the first time, or maybe you're changing your current Advantage Plan to another one, the first 3 months gives you a safety net to try out that Advantage Plan that you are on either for the first time or just a new Advantage Plan insurance company. It gives you a chance to see your doctors, to pick up your medications, to maybe have some tests done, and see how it's working for you. Is it really what you thought? Because what we see on paper sometimes isn't what we think it'll be once we start using it. Now, our goal is that it will be what you want and it works perfectly for you. But we want you to be aware that there is this time, the first 3 months of the year, where you can test out that Advantage Plan. You can see how it's working for you. Are you running into any issues? Do they make any changes? Here's another thing that happens. Sometimes the network for medical providers change. You have to generally be in network with your Advantage Plan. And if your doctors or the network that they're in may no longer take the Advantage Plan. I know last year up in Northern Indiana, one of our bigger medical providers dropped Humana. So they were not in network. So there were clients that I saw during fall open enrollment who came to see me during the Advantage Plan open enrollment because they now needed a different insurance provider than Humana. So that's another thing that might happen that you need to be aware of. So there are some key enrollment periods that we want you to be aware of. There's the fall open enrollment. There's the Advantage Plan open enrollment, and then there's special enrollment periods. And we actually have an enrollment period Facebook Live coming up in January that you'll hear more about shortly, that is going to go over all these. So you know, when are the key enrollment periods? What are the special enrollment periods? So you can be aware if anything changes with your plan or your needs or your medical providers, you know when or if you can make changes. Susan, do we have any questions?
I did get a question that was emailed to me,
Okay.
and This person wants to know, Geneva wants to know how she checks to see if her provider's still good to go with her Advantage plan that she chose.
That is an amazing question. Thank you. So there's a few ways you can do this. You can go on to the website of the insurance provider that you have. So if you have an Advantage plan, you can go onto their website and check the networks. There's a search tab that you can check for your doctors or your medical facilities. You can go on to Medicare.gov if you're on original Medicare to see if a provider is in the Medicare network. You can also call your providers. You can call your doctor's office and say, hey, do you take Humana HMO Choice Plan 1, whatever the name of your plan is? They're about 20,000 words long sometimes. And you can see if they're in network for 2026. So those are the key ways that I know how to look. Susan, are there any different ways that you use?
Well, besides calling the provider, um, I would probably just call the insurance company.
You're
And
smart.
that
Yes.
number is usually on the back of the
Mhm.
card for members.
Mhm.
And then they could help you hopefully um, verify that your specific provider is. Also, if you're looking to switch providers, they would have a list of the current providers who accept. But if it were me, I'm always checking multiple ways,
Mhm.
especially if you have an HMO, because there's no out of network coverage with an HMO. So if I had an HMO, I'm double, triple checking to make sure my providers are in the network before I go to that appointment.
Exactly. Yeah, those are some good tips, Susan, and it completely went over to my head. Call the insurance provider. But I do agree checking multiple ways because especially if you're going from one year to another, sometimes when you call the medical provider or even look online, they may not be updated for the next year. And
Yeah. Or people don't want to look online.
exactly, exactly.
They
Sometimes
want to
it's
talk to a
easier.
person.
Yep, sometimes that's easier. And here's my tip too. Write down the name of who you're talking to, just in case. You
Mhm.
never know. So, all right, any other questions, Susan?
Not at this time.
Okay. Well, how do you get a hold of us to go over your Advantage plan or to determine if you do qualify for an enrollment period? You can call us at our call center number 1-800-452-4800. You can go on to our website and then if you're watching us, you are following us on social media, you can send us a Facebook message, you can chat in the chat box. These videos are saved on Facebook for at least 30 days. So if you are watching the recording, you can chat in and we will get a notification that there's a comment and we will respond to that. If you go to our YouTube page, most of our videos are on there for about a year. Sometimes we take them down sooner if the material isn't relevant anymore, just to be safe so you're not getting wrong information. And again, this was just a quick review of what you can do, what you can't do. So if you have specific questions to your situation, give us a call and we'll be happy to get you connected with a SHIP counselor or talk to you ourselves about your situation and your needs. All right, Susan.
Megan,
Yes,
Sean, it just came through on my
perfect.
phone because I'm
But yes,
watching my phone for the chat.
yeah.
And here's her question. If someone changes Medicare Advantage plans during the open enrollment and
Mhm.
use their dental benefits with their current plan, will their dental benefits be used amount, will the dental benefit used
Mhm.
amount be applied to the new plan's dental maximum? So if you
Mhm.
change plans, but
Yep.
you get your dental services in the year before the new year changes, how are those charges apply to your old plan or to your new plan? I think that's what she's asking.
Yeah. So let's say you're with Aetna Advantage plan. Beginning of the year starts, it's January, you go to the dentist and you have some work done. They're going to bill the insurance company that you had on that date when you went. So you use up all your dental benefits on the Aetna. Then, let's say March, something happens, you don't like the plan anymore, and you switch to United. And it's a United that has dental benefits because there are a couple that don't have the comprehensive for United. So you're on a United that has all the dental benefits you want and you need more work done. So you go in April when the plan starts, you're going to have new dental benefits because you're with a new company. Does that answer the question, Susan, you think?
I think so, but I think, and Sean, I can bring you on and you can verbally ask your question, but I think what could be at play here, and
Uh-huh.
it's an interesting proposal.
Yeah.
Sometimes you have really expensive dental, I mean, dental services can be
Mhm.
super expensive.
Yes.
And so if you have something big and expensive,
Mm-hmm.
it may behoove you to receive those services to your maximum at the end of the calendar year and then finish up with that current service. Of course, the service would be new
Mm-hmm.
with your new plan at the first of the year, and you would have that first of the year's maximum dental benefit to use. So say you're getting dentures.
Mm-hmm.
And the first part of it, you get in 2025,
Mm-hmm.
you get I don't know, I guess your teeth pulled if you have any left. And then you get I don't know, do they take impressions? I'm not really sure
I'm
about
not either. I'm not a
getting,
dental person.
I'm thinking they have to take impressions they do
Yeah.
all the prep work, right?
Yeah.
And so you've maxed out your dental benefit. Let's
Mm-hmm.
say it's 1,500.
Mm-hmm.
But you still have to get the actual teeth and get them put in.
Mm-hmm.
So then January 1st of 2026 rolls around. Say you stay with your same plan and your dental benefit stays at 1,500 max. Then you can use that $1,500 since technically it's a new plan.
Mm-hmm.
It's a new year's benefit. And
Mm-hmm.
I don't think that's any different than employer group options
Exactly.
where
Exactly.
if you have a maximum for the year, you can exhaust that,
Mm-hmm.
and then your new year rolls around.
Mm-hmm.
But I would just caution, work with your provider to make
Yes.
sure that they're billing for services received in accurate years.
Mm-hmm.
Obviously, if you got your dentures and everything else before the first of the year, it would be fraudulent for your provider to indicate that those services were received in the new year.
Exactly.
Um, let's see, Sean, if we did not understand what you were asking, then let me know and we can bring you on the
Mm-hmm.
video.
Yes.
All
Yes.
right, or you can text in again.
Yeah.
So, but
Yeah.
that's, if I were looking at an expensive procedure, I might think about working it that way.
Exactly.
Yeah.
Yeah. But you
Mhm.
do want to be very mindful and like you said, Susan, work with the provider to make
Mhm.
sure that you don't run into some kind of issue with the coverage.
Right. Absolutely.
Yeah, because you don't want to be stuck with a big bill or whatnot. So
Mhm.
that's a very good question, Sean. Any others, Susan, or anything that I missed?
Nope. I just give a shout out. Thanks to folks that are watching today, live watching. So far, we have Chris and Chuck. Um, so always feel free to reach out to Ship with additional questions if you don't have them while we're here on live, or chat them in and we'll answer you later.
Yep, yep, we're happy to help. All right, Susan, so I'm going to turn it over to you to talk about what we have coming up.
Okay. Well, we have January scheduled, ready to go. And we have also, we're starting something new for the year,
Mhm.
Megan and I, and we're going to do some lunch and learns. And this is where, it's geared towards anybody really. But if people want to learn and take less than an hour out of their day to understand some Medicare options, kind of geared towards people who are working, but anybody can join us. And we're going to start off the year with just some basics about Medicare, but just quick little snippets. It's not going to be our full-fledged new to Medicare presentation, which we also are offering in March. But join us for these lunch and learns. So we're going to start off on the 8th with, do you really need Medicare? That's a big question when I meet people. People think that they have to sign up for Medicare, but some people, it's disadvantageous to pick up their Medicare benefits. So we're going to talk about all those scenarios. Then the next month in February, we're going to talk about all the different options you have for coverage along with Medicare. And then we're going to finish our quarter with just talking about what is Medicare, just a super duper basic on what Medicare is. So that's our lunch and learns, and those are going to start, during the lunchtime, 12 Eastern time, and they will not take an entire hour, so you will still have time to get back to your desk and finish up your lunch. But you can eat along while we're talking, and we hope to see you. Spread the news. And then in January for our Medicare Mondays and our What to Know Wednesdays on the 12th, we're starting out with a guest, Jenny Walden from the Indiana Primary Healthcare Association, and she's going to talk about other insurance options, specifically the marketplace. Some people call that Obamacare. It's the Affordable Care Act, access to insurance for many, many people, and Medicaid. So she's going to talk about those two options for health insurance. Then on the 14th, we're on What to Know Wednesday. We're going to talk about all those enrollment periods, like Megan said. So when you can do different things in Medicare, and sometimes when you can't. Then we're going to finish the year with our friend Barb Miller from the Senior Medicare Patrol. Barb's always a favorite guest, and she's fun and she's funny and she's very knowledgeable about the latest frauds that are going around. Now, we're going to talk about Medicare fraud, but she also throws in all kinds of other fraud. And with tax time coming up, we know that's a big time for frauds. And as well as the beginning of the year seems to be a particular time when those bad actors try to swindle us out of our money. So join us in January 4 times to learn more about Medicare, Medicare fraud, and other health insurance options.
Thank you, Susan.
You're welcome.
We have quite a few amazing topics coming up, not just for January, but further into the year too, that we'll be sharing soon. So thank you everyone for joining us, and we will see you in 2026. Bye, everyone.
Have a good day. Stay warm.